What do you think is the most common presenting complaint in GP? And if I told you it was various skin conditions, would you believe me? Now, for some reason I can't explain, I actually tallied up all of the presenting complaints that patients came to me with on a random week and split them up into specialties. And sure enough, out of these 76 patient contacts, a whopping 16, which is 21%, 1 in 5 were skin related. And in second place was mental health with 15, that's roughly 20%. And in third place were various ENT related symptoms at 13, that's 17%. Now, interestingly enough, or hopefully interestingly enough, I also made a note of the management of the patients. So what I actually did for them. Finally, I counted how many referrals I did and also how many patients I admitted into hospital. For those of you that don't know me, I'm Mike and I'm a GP in Manchester, UK, and welcome to What Does a GP See? And let me know in the comments below if the numbers you are going to be seeing here are comparable to your current practice. Before I begin, I will try to remain as emotionless and impartial as possible, because I know there are these ideas that GPs are gatekeepers, that we never refer, or conversely that we refer too often and clog up A&Es in hospitals with constant admissions. And these numbers here are neither trying to disprove nor prove those theories. This video is just for fun and entertainment purposes. As you can see here, this is the tally of GP presentations on a random week in May. I split them up into age, gender, and presenting complaint. And I also noted if they came in with 1, 2, or maybe even 3 problems. If we scroll down to the side here and I highlight this and press this button, I should get a graph. What we're gonna do is change this into a pie chart. There we go. As I mentioned, mental health, pretty common at the moment. Some neuro, quite a bit of MSK, so that's 12.5%. Some asthma, UTIs, bloods, cardio, that kind of thing. Fatigue, 4.2%. Now we also call this tired all the time, TATT. As you can see, quite a lot of patients come in complaining that they're tired. And so we have to know how to manage that. Surprisingly, 7.3% gynae. I often say that patients self-select. So women often do choose a female doctor to deal with their gynae problems. Although as a male doctor, I am more than happy to deal with those as well. Gastro, quite a bit, and ENT, I already mentioned that. One thing to mention, menopause. 3.1% of patients came to me with that. Well, it is a hot topic. Management. Now, before I show you the chart, out of these 76 patients, if your options are medication, referral, or nothing, as in, yeah, I didn't really do anything, we just had a chat really, which of those 3 do you think was the most common management? Well, it was medication. So I prescribed something 42 out of the 76 contacts, which is 55%. That's kind of more than half of the time. Patients got some kind of prescription from me. And crazily enough, in second place was I did nothing. 28 times out of the 76 contacts, it was just advice, and that's 37% of the time. And I don't really know if that's good or bad, but sometimes, and actually quite often, doing nothing is medically sound and a good idea. In third place came referrals, and I split those up into community referrals, so that's like physio, counseling, podiatry, or audiology. So that was 12 out of the 76 contacts, and that's about 16%. And lastly, routine hospital referrals, that was 10 out of 76. Let's try to create another fancy graph here. I'm gonna highlight these. As you can see, I requested some bloods in 8.5% of the times. We talked about the referrals already. Medication and doing nothing, 26.4% of the time. Now, sometimes, especially as we're starting out, we can fall into this trap where every consultation has to end with some kind of exchange. So either a prescription or a referral or that kind of thing. But sometimes patients just want reassurance. They just want to make sure that they actually don't have to do anything about their symptoms and that they will just get better on their own with time. As you can see here, 1.9% of the time, out of the 76 contacts I had, I admitted 2 patients and they were quite poorly. Now, the numbers in this second graph are slightly different because not everyone presented with just 1 presenting complaint. I have mentioned in the past that we are a 15-minute per appointment practice and we are not a 1 problem, 1 appointment practice. And so I counted up how many times patients had more than 1 problem for me to deal with, and the number is 25. So that's roughly every 3rd patient had a second problem to discuss with me, which for me is actually okay, and I kind of prefer it that way. Finally, surprisingly, only 4 patients had more than 2 problems. Now, I would absolutely love to turn this into a bit of a discussion with you guys. So what do you think? Are these numbers good? Are they bad? I mean, do they scare you or do they impress you? Let me know what you think in the comments below, and please get in touch if you want me to share the template I use to track your own clinics. Otherwise, good luck.